Hi guys, Dr. Matt here from Robina Chiropractic Wellness Center. Today I want to talk to you about scoliosis, or a deviation in the spine. Now some of you might have heard of that. Today I'll talk a little bit about some of the effects that scoliosis might have. Now, scoliosis we normally measure in the chiropractic world with what we call a Cobb angle. That's angles that we draw and we measure them and tell you exactly where you're sitting at. So normally you'll have to be above about, say, 10 degrees for us to classify things as a scoliosis. Now, scoliosis can not only affect your spine, but also can have other effects. Now, other than things like pain and muscle tension and imbalances, it can also cause some nerve compression. And some people actually have restricted ranges of motion. But not only that, in more severe cases, we have the scoliosis compressing organs, and we also have breathing difficulties. In situations like that, normally the patient would have to go for surgery. Other cases, especially when they're young, they will have to go for bracing, or if they're minor, Dr. Andrew and I can deal with them via chiropractic, or then with some traction, and we were very successful in actually dealing with these specific cases. Now, the other thing that people don't talk about is the psychological effect that scoliosis might have on self-esteem, especially with younger people having to wear a brace or having uneven shoulders or a hump on their back. So the big key for all of this is early intervention. So if you have a family history of scoliosis, I urge you to come and see us in the office. We'll do a thorough investigation, we'll do x-rays, we'll tell you exactly where you're at in terms of your risk factors, and we'll monitor this for you. So if you've got any more questions about things like scoliosis, please don't hesitate to ask Dr. Andrew and I about these things. We do see a lot of these cases on a weekly basis. See you next week.